There's this story that plays out all across Africa, over and over again. Visionary health policies get launched, and they're just full of incredible promise. But somewhere between all the paperwork and the actual patient, that promise, it just kind of gets lost. So today, we're going to dig into why that gap exists and how a really simple shift from hindsight to foresight could be the key to finally closing it. And this quote, wow, it just gets right to the heart of the problem, doesn't it? It's almost never about a lack of good intentions. The real villain here is delayed visibility. The fact that leaders are being forced to make these huge, critical decisions while basically staring into the rearview mirror. We're going to unpack exactly what that means.
And you've got to admit the ambition is absolutely there. I mean, if you look at health policies across the continent, you find these bold, really forward-thinking plans. They're all designed to give people better care, to widen access, and to save lives. On paper, that promise is crystal clear.
But this is where we hit the snag. The vision for a healthier future is like one side of a canyon, and the real-world impact is the other side. And the bridge that's supposed to connect them, the execution, that's where things so often seem to fall apart, leaving all those amazing promises just unfulfilled.
So why? What are the specific hurdles that cause these ambitious plans to stumble right before the finish line? Let's take a look at some real-world examples to see what's going on.
And look, this isn't just an isolated issue in one or two places, it's a pattern you see all over the continent. You've got Ghana, Kenya, and South Africa, all of them pushing for universal or decentralized care, but they get bogged down by money problems and endless implementation delays. Or take Nigeria, where these big budget promises for health just don't get met. You start to see a common thread here, from funding gaps to, as you can see in Mali's case, a simple lack of real-time data on the supply chain. These are not failures of vision, they're failures of logistics.
So, all of this leads us to what I think is the core diagnosis. Let's just call it the rearview mirror problem. And it's all about the kind of information leaders are forced to work with. Okay, think about how health information usually flows, right? You've got manual data collection, which then leads to these quarterly updates, which are then analyzed. Everything is retrospective. It's all about what's already happened. By the time the decision makers even see the report, the reality on the ground has completely changed. The system is just fundamentally too slow for a fast-moving crisis.
And this is what that disconnect looks like in the real world. On the left, you've got the old way. Reports finally land on a desk, but the disease spike they're talking about has already peaked. The analysis is based on past events. But on the right, in the real world, medicine stockouts are happening right now. Decisions are made way too late because treatment patterns are shifting literally every single day. Okay, so if reacting to the past is the problem, what's the solution? How do we actually flip the script from just reacting to what's happened to anticipating what's coming next?
This old system, it forces leaders into a purely reactive mode. It's like trying to drive a car down a winding road, but you're only allowed to look in the rearview mirror. Sure, you can see exactly where you've been, but you have absolutely no idea what's around the next corner. But what if we could change that? What if leaders could actually see the road ahead? What if they could anticipate needs, predict crises, and act proactively instead of just reacting after the fact? Just asking that one question, it changes everything. Well, to do that, you need a totally new way of thinking, a new paradigm. You need what you could call a predictive health engine. It's an infrastructure that's built not just to report on the past, but to provide the kind of intelligence that actively shapes a healthier future. And hey, this isn't just some sci-fi theory. A company called AfriPharm Health is building this exact kind of predictive infrastructure as we speak, and it's designed to give health leaders the exact forward-looking visibility they've been missing all this time. So what's the secret sauce here? It all comes down to something called real-time intelligence. Basically, it works by gathering data from a huge network of pharmacies and hospitals. Now, this data is anonymized, which just means all the personal information is stripped out, and it's aggregated, so we're looking at broad trends, not what any one person is doing. The result is a live dynamic picture of public health as it's actually happening. And the insights you get from that are, well, they're truly actionable. I mean, imagine being able to detect a disease spike before it turns into a massive outbreak, or spotting a medicine shortage as it's just starting and being able to fix it proactively. You can track treatment patterns across different regions, see what's affecting different age groups or genders, and you can do it all in real time. So with that data, you get this powerful new workflow. Step 1. You can actually forecast potential spikes before they overwhelm your hospitals. Step 2, you can adjust your orders to prevent stockouts from ever happening. And step 3, you can tailor your interventions to have the biggest impact. And maybe most importantly, you can finally evaluate if a policy is working with live metrics instead of waiting months for an outdated report. You see, this whole process, this whole new workflow, it represents a fundamental shift. Instead of having a static, rigid plan that's set in stone, public health can finally become what it's always needed to be: adaptive. And this right here, this is the ultimate payoff. This is what it's all about. Your policy is no longer some rigid document. It becomes a living, breathing strategy that adapts as conditions on the ground change. And that adaptability, it builds resilience, making the entire health system stronger. And the end result of all of that is simple, and it's profound. Lives are saved. So here's the bottom line. Real-time intelligence isn't some luxury. It's not a nice-to-have. It is the essential backbone of modern strategic health policy. It's the tool that can finally close that massive gap between good intentions and real-world impact. So really the question isn't if this shift is going to happen, but how quickly we can make it the new standard for everyone.